Recently, the state of the nation's health sector has raised major talking points as a pregnant woman and the unborn child died while waiting to receive medical attention. It was alleged that by the deceased husband that the hospital demanded the sum of 500,000 naira before admission. So we have joining us in the studio the President, Association of Nigerian Physicians in the Americas, Dr. Cliff Eke. He will be speaking on how to combat the scourge of maternal mortality, improve our health sector significantly, and bring in, we want to bring down the brain drain, you know, sort of possibly reverse JAPA and all the other things the association is doing to assist our health sector. So welcome to the show, Dr. Eke.
Thank you very much.
I was saying just before we went live that in Nigeria, you pray not to fall sick because it is literally, being sick is life and death, but here it is literally more of a life and death situation because of all the other challenges involved with the health sector. So I don't even want to start the conversation with you around the story itself, which is funding the health sector, because really that isn't you. But can we start with reversing JAPA?
Sure. Because
I have had in the past 5 years, I think almost every other year had to use a different dentist. So now, before I got into another dental clinic last year, I found out that this doctor has been here for a long time and she has maintained that hospital, because you go and see a dentist today, you go back a few months time, the person is now in the UK or the person is in the US.
Dentists, the gynaes that I have.
The gynaes are living per second, you know. So how do we, what do you see as possible solutions to reverse the JAPA? How do we benefit as a country from JAPA?
Okay. First of all, thank you for having me and your view. Very popular show, by the way.
Thank you for
and like you said, I'm the president of the Association of Nigerian Physicians in the Americas, AMPA. And we've been around for 30 years.
Wow.
We're celebrating our 30th anniversary.
Okay. So the JAPA has been happening since.
We'll get to JAPA shortly. But this is why every year AMPA will come to Nigeria and do what we call AMPA Week. Involves health education, healthcare advocacy, and then service. Service, we do trainings and capacity building. We do free surgeries, medical care, free eye surgery, dental care, and then trainings in helping babies survive postpartum hemorrhage. Even we're doing today, as I speak, our team is doing mental health, wellness, and happiness workshop. So we bring a whole lot of menu or repertoire in the health field to our people yearly. And this year we're doing it in Lagos, in partnership with the Lagos State Government, the LUTH, Lagos University Teaching Hospital, FMC Ebute Metta, we have Rotary International, we have Indo Eye Clinic Foundation, among with other partners, M1, etc. Now, we'll come to your question. The JAPA syndrome. We're trying to JAPA that now. Right? But the JAPA syndrome, you know, everywhere, basic human right or basic human need is we want security and want to be well, right? Most doctors that I've talked to that are here, we want a secured environment. That's number one. Two is they want to be compensated better. So somebody who is here done all their trainings and compared to what they earn when they leave Nigeria, and then the working conditions. So all these are factors that
has led to it.
Has made people to leave. And also healthcare financing is very important. Health is not cheap, even though I believe it to be a universal right for every human being. And we come here, we give freely, but we are paying for it. So when we come, what we do is free. We use our own resources and volunteer. So eventually, it'd be nice to have our healthcare system. We have universal health insurance, but people don't have access to care. That is where we need everybody, or the government, we need to really invest in that, and especially in primary care and prevention. Because the curing is too expensive. We have to start prevention, which is cheaper to do.
So how much participation do you get? How many doctors would you say are members of AMPA?
Okay.
And how committed, how many of them are willing to come back every year when you have to come back, to do this? I was a beneficiary, not directly. I, recommended somebody for a myomectomy, and she was able to get pregnant immediately after. But it was because some doctors had returned and were using the facility where I usually go for my checks, and I heard about it and quickly filled her name. And so I know how far-reaching this can be and it was a entirely free process.
Wow.
You know, so I know how far-reaching this can be, but I'll be surprised if AMPAN has up to 1,000 doctors.
We have more.
That
wow.
come.
AMPA.
That come.
Well, no, not that come all the time.
Okay.
But the membership, we have a potential of 4,000 membership.
Wow.
But we come here typically about 70 or so. But this year in Lagos is the largest ever AMPA week. We have 130 professionals coming.
Wow.
Doctors, dentists, nurses, even residents and medical students. And it's been fantastic. But the idea, we don't just want to come and do AMPA week and leave. That's why we emphasize trainings and capacity building. So whatever we bring, we want our colleagues, we always have partnership. I've mentioned some of them to you, whereby we work with our colleagues and share best practices so that when we leave, it continues. Something else that can continue when we leave is because of technology now. Everybody has a smartphone. Everybody has internet. We're able to have what we call telemedicine. So even if I'm gone, I can consult. I told you, send me a picture of your son's wound, for example. I can look at it and advise, right? And we started this in 2022 when we were in Edo State. After our AMPA week, the governor bought into the concept and we established a telemedicine in the primary healthcare center. Started with one, now we're in five to seven of them. So every month,
the doctors have
our
access.
physicians in the US can consult. Patients are gathered in the primary healthcare and through video platform, we can actually consult and recommend and take care of patients. So that's one way to Jakpada. Another way to Jakpada is a lot of us are coming back actually to establish. Yeah, most recent is Dr. Julius Oni. He's a famous orthopedic surgeon.
Yes, I follow him on Instagram.
Exactly. And he's an AMPA member.
Oh.
And he just moved back in the last year or so. And there are others. Dr. Yemi Johnson has been here. Dr. Wale Suleiman. These are all AMPA members. Dr. Ben Anyango Inowere. He has Regions Hospital. Okay, it's been here. So these are just some examples of AMPA members that have come back. And more will come back. Established. And are doing well.
That's good.
But the things I told you about security, healthcare financing, we need to be able to, if I want to start a practice now, I shouldn't be able to come with all the cash up and put it, no. But if there are some loans in the US, grants or loans which are single-digit interest loans, that then you can pay gradually as you progress in your practice. People will be able to come.
Okay, so I understand that sometimes, aside from some benefits, like you said, financial benefits or better environment to work at, that another reason why people Japa is because they feel that they need to go learn and get better education in terms of the healthcare sector. Do you think that for people or doctors or nurses that don't have the opportunity to travel, do you think that they are shortchanged by the trainings that they have here? Or do you necessarily have to Japa to get the trainings that they have there?
Very good question. Nigerians are one of the most brilliant people worldwide. In fact, in the US, we are the most educated immigrants, more than the Chinese, more than everybody. So we have the brains. And what I've observed in our schools here is the theory, they know, they can read it. The challenge is the practical. You can't read everything and practice medicine by reading. That's where some of them may leave to get that advanced training. And this is part of the reason the AMPA week will bring the training here. For example, we're doing advanced laparoscopy surgery. In fact, I was at Luth 2 days ago and worked with the locals to do a laparoscopic colectomy. We took out somebody's colon, they had colon cancer, with tiny little holes. At FMC, Ebutemeta, we're doing laparoscopic cholecystectomy. Again, the same thing, we take out a gallbladder. And other ERCP and other minimal invasive procedures, which were, again, capacity building. So you don't always have to leave. However, we need to hopefully revamp our educational system. Interestingly, over 25 years ago, AMPA was instrumental in redoing the medical school curriculum, which had been in existence since the British left. But with the help of a grant from USAID, AMPA introduced the first change in the medical school curriculum, which some medical schools adopted. It's good now we have the ministers of health, Dr. Pate, Dr. Salako, and also Dr. Alausa, who was Minister of Health, State for Health before, now he's Minister of Education. And they are actually AMPA members. They are AMPA members. And with their help, and also with NIDCOM, Honorable Abike Dabre, you guys know her.
Yes.
And with Dr. Lausa's position now, he's able to influence more education, coming to the training you're saying. So we're hoping we can collaborate. They're trying to increase the number of healthcare providers, not just doctors, but nurses, midwives. I think the goal is to do 1,000 a year, and even 2,000 and 3,000. So they're also working to rehab the facilities. I know he had reached out to me about 2 weeks ago for AMPA to have a member on the task force.
Oh, to support rehabilitation.
Yes, to rehabilitation of schools. So not just the physical, but also the curriculum. And AMPA and other diaspora organizations, MANSA, CAMPA, these are all our other sister organizations.
This is really good. Sometimes the government are trying, they're making moves that we don't get to hear about. Right. So it's interesting to hear your perspective. We'll take a quick break. When we return, we'll talk about maternal mortality. We're women. This affects us and it affects our constituency. And we'd like to see how we can improve, reduce the number of maternal mortality in Nigeria. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.